So at what point does somebody need a fusion and not a fusion?
I compare it to my patient like a tire of a car. I say a disc is like a tire of a car that cushion the car against the road, cushion two bones against each other, keep the space open for the nerve to pass through. Some tires you can patch, some tires you cannot. Depending on the consistency of the disc, if there's only one part of the disc pushing on the nerve, many times we go and trim them. We call them macrodiscectomy.
Okay.
But one time, if there are like 5 different holes and the entire content of the disc is spilling out, or the disc consistency is not conducive to healing, then that disc is beyond just patching. That is when fusion becomes necessary.
To kind of hold it open so you don't hit the nerve.
So that the material of the disc is not getting pushed toward the nerve and causing significant damage.
Okay, and then you would fuse. That's a person that would
is
need
a situation
fusion. It's
that needs
only
a
when you
fusion.
can't save the disc.
Correct.
Okay,
When
and
if you cannot save the disc, meaning the disc is beyond saving, and the motion, any kind of motion, is only bad one, that is where we recommend to the patient to get rid of that disc completely, and that is by definition a fusion.
And then you do these fusions minimally invasive
And
across the board, whatever you possibly can.
More than 95% of the time we do it with the small portals, keyhole-like, without damaging the surrounding tissue.
And when I see commercials where they leave with a Band-Aid, that's possible in some cases?
That is a common, that's a common place for us, but we have moved way beyond just what happens on the skin with the Band-Aid. We truly saving all the tissue underneath as well.